Welcome everyone. Welcome those that are present in our room today and to our virtual guests out there in virtual land. My name is Lenore Consiglio and I am the Senior Director of Community Services for the Gear campus. I have a few technical statements for you. This program is being recorded for future use and listening. You are all muted, those of you that are that are virtual. Any technical questions or statements that you have, we ask that you please hold them to the end so we can give them the attention they deserve. At the bottom of your screen, there is a toolbar and you will see a button that has a Q&A. You can communicate your questions to us through this method and you can type them in at any point in time. For those of you that are not familiar with GEAR, senior community, it's really important for you to know that the entire team across campus is committed to focusing on what really matters. And what really matters to us is caring for you, your friends, and neighbors in the Northwest community. We have an extensive on-site campus of services, which include independent living apartments, assisted living and memory care apartments, skilled nursing and rehabilitation, outpatient physical therapy, pharmacy services, and dial-a-ride. Unique to GEAR is our wellness program, which empowers and supports ongoing education and wellness so everyone can live their lives to the fullest. At this time, I am pleased to present to you Dr. Christina Befanis, who is leading the development of the wellness program at GEAR. Chrissy, as we all know her, has a varied and diverse experience and background. It includes advocating for clients in the healthcare service arena, mentoring new therapists. She is an expert in leadership and clinical development in skilled nursing facilities, hospitals, home care, and now at GEAR. I'm pleased to present Chrissy to you.
Hello, everyone. Thank you, Lenore.
Thank you.
My name is Chrissy, and I am an occupational therapist. I've been an occupational therapist for 21 years, and I've had the pleasure of providing services to people from birth to 108. I've worked in every setting except a prison so far, and that is also on my bucket list. I have a few certifications as I come to lead the wellness program, and one of them is the A1 certification, which is a cognitive assessment that we do with people who are brain injured. But today, we're going to talk about brain health. So as I was putting this presentation together for all of you, I was astounded by the amount of research that's out there. Why is it out there now? Because we are living longer. So here we are living longer, we have access to preventative care, we're healthier, and everyone is studying what happens now. As you know, and I'm sure a lot of you know, there are people who are living long, but perhaps not living well. And maybe they're not enjoying good brain health. So I wanted to start with some of the evidence and really look at all the factors that contribute to our brain health or the brain deterioration. I want to talk about what we can control, perhaps, maybe things we can't control. I'd like to talk about the lodge's role in that. I'd like to talk about what I do in some of my programs, and I will give you some examples. And I want to hear what you're doing, because you guys are my heroes, and I learn more from my clients each week than I do from school. So here is our research. We've got the World Health Organization, we've got the White House Conference of Aging, the National Institute of Health, talking about how healthy aging goes way beyond disease and disability. You can have healthy aging despite the process of disease. Rowe and Kahn talk about successful aging, and they characterize it as involving freedom from disability along with higher cognitive, physical, and social functioning. Literature reviews have been done where they note that intact cognitive function was one of the big factors that contributed to successful and productive aging. So we already know that. So why is it that some people do it better than others? You know, my curiosity was piqued too. What are they doing better, more of or less of? You know, how can we all get there? And why is it that some of the health habits that we developed in our younger ages or middle ages are not sustainable as we age? You know, what do we need to do differently? So if cognition is a newer term for you, I have a definition here. It involves your higher thinking processes. So learning, thinking, reasoning, your memory, problem solving, decision making, and attention. And some of you might have noticed either with yourself or with a loved one that when all of these things are not there the minute that you need them, or if there is difficulty with some of these processes, it can really impact your quality of life. So, you know, I like to think about examples if you've seen them with loved ones, if you notice them in yourself. Changes in cognition are not part of normal aging. I just want to highlight that. So your brain is a unique organ. It is an organ, right? Like your heart or your lungs or your liver, but it does many more things. It's got a lot of different functions. It's responsible for your mood. It's responsible for your sensory and your motor processing, thinking. So we want to take really good care of it. We've got to protect it. Your brain needs to be cared for. It needs restoration. Part of that, we have things we can control and things we can't. You've got your intrinsic factors, which are genetically linked most of the time, things like family history of dementia, diabetes, maybe some sleep apnea. And then you have your extrinsic factors, and these are your habits, your lifestyle, rituals, things that perhaps you can control. So you've got, you know, your level of exercise, your level of socialization, maybe some bad habits that you developed when you were younger. There's even evidence that shows that exposure to prolonged stress can lead to permanent changes in the brain. And we actually can have some control over that. So I put that under extrinsic factors. I mean, that's the good news. We can control those things, a lot of them. There were a lot of studies that showed the environment in which we live can either positively or negatively impact your brain function. So I always think about, I do home care as well, as many of you know, and you know, I may go into a home where a loved one was struggling with memory and keeping a daily routine. And I look around the environment and the lighting is terrible and there's clutter everywhere. And there are not cues that support a daily routine to tell that person what they should be doing next if they can't remember. And so that's one of the things that I assess when I'm doing an occupational therapy assessment is how does this person's environment support them being successful in their routine? And so that's one of the things we do here at the Lodge as well. And I'm going to talk about that a little later. So back to some of our evidence. As we age, the evidence shows that factors like social isolation, stress, loneliness, lack of physical activity are directly related to cognitive function. But the good news is there's abundant evidence also showing that as we increase the support for older adults to minimize these factors, you actually can support optimal cognitive functioning and delay further cognitive decline. So there's lots of research on cognition and cognitive decline right now, and we know cognitive decline leads to impairment in the ability to care for yourself ultimately, increases your use of healthcare resources, leads to hospital readmission rates after an illness, increased rates of institutionalization, like living in long-term care, increased mortality rate, and of course, decreased physical and emotional well-being, because if you're going through this, you've got awareness. So I want everyone to just give me one thing that you're doing right now. Before we get into it, everybody yell out one thing that you're doing to take care of your brain health. Because you guys know a lot. I know you all.
Adult coloring pages.
Good. Adult coloring. What else?
Sewing.
Sewing. Excellent. What else?
Exercise.
Exercise. Absolutely. What else?
Reading.
Reading. Yes. What else?
Eating.
Yes. Nutrition. Yes. And actually, when we're seeing people with cognitive decline, there's most often a weight loss. And so we'll talk about that later too, how that can tie into it. Anybody else?
Word searches.
Word searches. Yes. Yes. I have one. I've recently started dancing again. So we're gonna keep talking about what we can do and how we can do it even better. So there's so much research about stress, the link of stress, loneliness, and social isolation on cognitive function. There are some studies that actually show, and I think I mentioned it, that prolonged stress can affect permanent changes in your brain chemistry. And other studies showed that social isolation was directly linked to memory impairment in older adults who already had a diagnosis of depression. So I want you all to think about a loved one or a friend or people you've known in the community who have been struggling, because it becomes a cycle. And what we see is that you might have the social isolation and then your routine changes and suddenly your routine becomes less rich. And then you can't convince that person that they want to do things on the outside. And so I know for people who have loved ones in this situation, it can become very frustrating, and it doesn't have to be. So protecting and enhancing your cognition. We already knew daily physical exercise, intellectually stimulating brain activities, any kind of socialization, volunteer work, service, travel, social engagement, being part of a community, being engaged. I don't know how many times I can say a structured, meaningful routine, and that's going to mean something different to everyone. Because with very high functioning cognition, you don't have to have the same routine every day, and you don't need the same level of structure. But for all of us, that routine is important, and it is linked to our thinking processes. And then cardiovascular health, super important, and it's not just about nutrition. You've got diet in there, you've got your sleep health, you've got your stress factors and trying to keep them low, and medications, being on the proper medications at the proper time. So no matter how much we're doing, we can always do more, or we can take it up a notch to make sure that we're giving ourselves the proper amount of brain nutrition, brain health. And I want you all to think about what is on your bucket list. What have you been thinking about that you want to add, or maybe there's something new that you want to learn, because that's directly linked to good brain functioning. And how can you modify your routine to add even more healthy brain activities? So the Lodge is set up to try to support everyone and support them in the routine, a daily routine that's productive and in brain health. We've got wellness checks, which I'm going to talk a little bit further about. Medication management. Recreation does a beautiful job, and all of their programs are targeted for brain health. We have an accessible environment, which is so important, as I mentioned before. Access to healthy meals and supportive healthy habits. You can have assistance with structured routines if that's something that's important for you, especially if you're moving in from the community, and that will lower the stress. A lot of times people's stress is tied into the fact that they've lost their routine and they literally don't know what to do next. That's where I find some of my home care patients. We have tons of opportunities for physical activity. We've got the Y, we've got strength and balance classes. I think they do a beautiful job here with opportunities for social engagement and opportunities for new learning. And they have transportation to appointments and destinations, which decreases the stress. And I love our modern accessible library. I love to throw that in there. Can't not mention that. So wellness checks, I participate in that process along with nursing. You can determine your risk factors, your at-risk factors, so falling, at risk for hospitalization, at risk for physical decline based on your diagnoses. Some people need help understanding what their vitals mean and why they're being monitored and why that's important. Or we might talk about a new medical diagnosis and help them manage it. We have opportunities for nutritional education. I love to, along with nursing, discuss the medication routine and any pain that you might be having, because I can offer non-pharmacological options for that. I love to learn about what you enjoy doing. And for people who move into the lodge, it's really important for me, because if you move in healthy and something does change, I have that written down and I can work with you later on in life to make sure you still find a way for you to do that. And I'm going to talk about that in one of my case examples. It's important for us to look at what you can do safely alone and where you need help, because people are not always aware of where they need the help or how changing something can make them actually more productive and more independent. I love to discuss healthy changes to your daily routine and healthy habits. And so if any of you are looking to do that, you know where to find me. And one of the most important things about wellness checks is we can catch a functional change as soon as it occurs. So if you were always an independent walker outside and suddenly you're not liking the hill and something's going on, I want to know what's going on, and we'll find out. Maybe you've had a change in your vision, or maybe you need a different assistive device. We want to keep everybody independent and functional. A wellness check can determine the need for additional medical consults or a therapy evaluation. And we can also work on setting personal goals so that you keep yourself healthy. Okay, accessible environment. I mentioned I love walking into the lodge because it's so beautiful and so peaceful. We've got wide open spaces here. I'm a big lighting person. In most cases, I love the lighting in the different rooms. I think they support safety, they support participation. We've got an accessible library to keep people engaged in reading. Just the environment of the lodge promotes mobility. I mean, you can do wonderful walking on the first and second floor in loops. You can walk outside on our campus. We've got accessibility to recreation events 7 days a week, and access to all of the medical staff and transportation. There's access to nutrition. I find that people who make a change from the community to a setting like this are less likely to fall. And home environmental assessments, which are something that I do, and I can do them anytime, also can contribute to your decreased falls risk. I can make some suggestions for that. So, brain health. So it's never too late to become brain healthy. A lot of you go to our daily strength training classes and balance classes. I see all of you walking indoors and some of you outdoors. Those of you who like to swim, we have the Y on the campus. Some of your healthy habits might be adding nutritional choices or making sure that you're maintaining a healthy weight or that you're staying hydrated. And I know that that can become challenging with aging. And like all of you mentioned, reading, art, music, learning new things. I was just looking at 2 articles this morning about how music supports healthy brain function. Meditation is super important, and on Wednesdays, if you come to my beginner balance class, we do some good meditation in that. And then your medication management. Having that right dose at the right time and making sure you're on the right medications, and that if you've had a change in your weight, that you don't need to maybe have your medications reconciled so that you're on the right dosages is super important for your brain health. So I want to just take a minute and talk about the different programs we have here that are targeted for brain health. And I know that all of you engage in these programs and you participate, so you know this, but our remote people may not know. We have the morning news every morning, which engages discussion about current events and other events. I think you do a lot of good discussion in that group and critical thinking. We have strength training with weights and 2 balance classes, and both of them are adaptable to different levels. Community exploration trips. They offer group games to challenge problem solving and competition, musical performances and concerts. We have collaboration with the Taconic Learning Center, and they offer arts and crafts and I think cooking periodically here. So all of those things, which there is sufficient evidence for brain health. For those of you who I've had the pleasure of working with, you know that everything that I do is evidence-based. And so I didn't go into too much of the evidence on my programs, but these are a few of them. So if you're looking to improve a memory loss, if you need help with your sleep routine, if you want to talk about independence in medication management, I offer a low vision program. I do aging in place right here at the lodge and in the community, falls prevention and environmental changes. We look at health literacy and nutrition habits because, as I mentioned before, things that maybe worked for you in middle age may not be what you need at this age right now. So it's good to always double check and make sure you're giving yourself everything that you need. I offer opportunities for safe mobility. So if people are having a change, usually they come to me, otherwise nursing refers, and we just look at what's going on. You know, sometimes it's a vision issue, sometimes there are other medical things happening, and sometimes the person just needs to look at using an assistive device for the very first time, or look at a different one that's more supportive or less supportive if you're recovering from illness or injury. So that's one of the things that I do. I can do technological apps with you for wellness, and those of you that already use them, I want to ask you a question. Do they have levels of difficulty that you can advance? And are you really making sure you're doing ones that are challenging memory, problem solving, critical thinking, because they have them and they're wonderful. They're so good. So we can talk about that if you're interested. I do fitness to drive here. And driving is an ADL, and people who have driving in their regular routine are more independent. They can be more productive. So that's one of the programs I do. And I also do leisure exploration, which is also an ADL. So a lot of times people have said their whole life, when I retire, I'm going to, and then they haven't done that. So that's one of the things I can do with you. So I have 3 examples of programs that I do, and just a case study with it. Managing memory loss. So one of the things that I offer are the use of external supports, especially if you live alone. So a pillbox reminder, a calendar, a daily checklist, finding ways to have a consistent daily routine. So waking up at the right time, going to bed at the same time, making sure that you're having meals, that you know when you're showering and dressing and when your appointments are, making sure the brain has what we call just the right challenge of stimulation. Daily exercise and movement, which I know Mike Mangini will talk more about, but it's directly linked to cognition and thinking, making sure you have proper nutrition, hydration, medication, and that you have really good engagement in the activities that you desire to do, the things that are meaningful for you. And what I always say, supportive of dignified, productive lifestyle. So here's Mary. Mary had a diagnosis of early dementia. She was still very independent, very mobile. She was able to complete her routine more or less independently. And she was a newspaper reader. She enjoyed that morning solitude. She had a love of fine food and exercise, and she played the piano. And with that early dementia diagnosis, as things change, you know, she was forgetting to take her medication, and she was at high risk of falling because of the clutter in her living space. So supports for Mary would be, in a setting like this, medication management. Even in the community, you can get a pill box for medication management, daily housekeeping for safety to support falls prevention, nutrition, because there's that motivation to eat, encouragement to continue her piano playing and continue her walking, which were both really important to her. Motivation really plays into our participation in life. So I would never coach her to do things I thought she should be doing, but support her in the things that she wants to do. And make sure that she has access to a quiet reading space, because as her attention starts to change, her reading is deteriorating if she doesn't have a quiet space. And so supporting her in place as she ages, I want to provide her with more prompting and more reminders. She might start to need some physical assistance to take care of herself. And I might want to recommend different types of reading material just to keep her reading if her attention starts to change. So we look at the person at whatever level they're at and what skills they have, and we want to keep them going, because even with cognitive changes, using the skills that you have can slow down more cognitive changes. That's why it's so important. Sleep and brain health. One of the programs I do here is sleep hygiene. We know that impaired sleep affects the brain's ability to recharge and restore. It affects the brain's ability to clear toxins. They actually show that people that have a sleep disorder have more plaque than their peers who are sleeping the desired amount of hours. It can have problems, it can cause problems with attention or decision-making. And actually, people that have chronic sleep problems have slower motor movements. So evidence shows that it can actually cause the onset of dementia at an earlier age, or more serious brain issues, and also the health issues. So high blood pressure, different cardiac issues. So here's Paul. Paul was a mess. Paul had difficulty. He was waking up at night to use the bathroom. It was very disruptive to his sleep. During the night when he would wake up, he was unsteady and he had difficulty falling back asleep. And then there was a lot of anxiety related to this routine because it messed up the mornings. He would sleep through breakfast, his medication would be late. So we talked to the doctor about Paul's medications, and we changed the timing of some of them because some of them were causing him to wake up more often than necessary. We recommended a spill-proof urinal, so some adaptive equipment so that he didn't have to fully get out of bed, which was waking him up. And we looked at his nutrition, made sure we limited some sugar, caffeine, alcohol, and fluids. We looked at his routine and made sure he had a regular get up and bedtime time, and that he was able to get outside and have sunlight every day. And we also made sure that he had a sleep routine where he kind of withdrew from the world in a period of time before bed, about 30 minutes before bed, so that he could unwind in a calm environment, in a dimmer light. We added some daily exercise for Paul so that he could keep his mobility, which was changing. And then we also recommended a walker and a grab bar for when he did need to use the bathroom. So we're keeping Paul, trying to keep him as productive as possible and helping him sleep. And what a difference that made for Paul. So we're back to physical activity and cognition for my last example. So many studies demonstrate a positive relationship between regular physical activity and cognitive functioning. People that do higher intensity exercise have more significant results. And many studies demonstrated that regular moderate exercise had a direct positive impact on functional cognition. So think about yourself when you're sitting all day. If you happen to have a day where maybe you had a bunch of doctor's appointments and you're sedentary, or even in this seminar, think about how you're processing and if you're feeling a little sleepy. But if that's your routine all the time, maybe you're sleepy during the day and you're not sleeping at night. Maybe your attention is not good. So it really does affect you. So as we get older and our mobility starts to change, we still want to keep as much of a level as mobility as we can. I mean, that is the most important part. Some people say, oh, if I have to use an assistive device, I'm just never going to walk again. I'm going to lay here and die. And we know that is not doing you any good. So you want to be as mobile as possible. There's so much evidence that shows that people that have good balance and good walking speed perform better on tests of memory and reasoning. And that the more mobility you have a greater brain density in certain regions that are associated with memory than people that are not as mobile. I found it really interesting that there were studies that showed that exercise interventions can actually improve your ability to dress yourself and bathe yourself independently, but it makes sense. So as our mobility begins to change, our balance begins to change, our safety changes. People that have experienced falls know what I'm talking about. You start to withdraw from the activities that you enjoy, you start going out in the community less, your brain actually suffers and your routine starts to become less rich. And in my mind, it can be a chicken and an egg thing with the cognition because they're so tightly linked together. So I love being able to screen people and do wellness screens. Just to look at what the mobility is and just make sure everyone's moving here. You all know that I love to do that, keep you moving. I want everybody to feel confident about their ability to move outdoors, to go places in the community and feel like they have their balance. And it really is linked to that healthy activity level supports brain health. And there's evidence that shows that it can increase participation in your leisure activities. So if you get somebody moving and they feel confident, all of a sudden they're going to church, they're going out to lunch, they're going to the grocery store, they might even be on a plane, and they're doing the things that bring them joy. So my last example, a very special example, because this is my mother-in-law. Lifelong patient of mine toward the end there. Connie lived to be in her 90s. She worked into her 80s. She was always very physically able. She was a hummingbird, the doer of all things. And suddenly, with her lower back issues and the surgery that she had, she started having chronic pain and she started having multiple falls. She had a diagnosis of vascular dementia that ran in her family that people lived with for 20 or so years. And she would not use an assistive device. She would not. For years, she just kept falling and she wouldn't use it. So what we saw is she began to withdraw from the things that brought her joy. She no longer drove. She became increasingly more forgetful. She needed help with bathing and dressing. She came to live with us here at the lodge for a while. She had poor appetite. She was sundowning. She had increased depression and anxiety, and she saw a big change in her incontinence, which really was a dignity issue for her. She came over to the nursing home, which is where she was for a few years, and she worked with us in therapy every day. And finally, she agreed to use a four-wheeled walker. She got intervention for daily strength, posture training, mobility. And really the focus for her was on the consistency of her routine and the things that brought her joy. After working with the therapists, She was able to walk at a better speed. She had a better step length. She was able to go out in the community with her grandchildren, to go to church. She got her incontinence under control. She started eating in the dining room with people and socializing. And lo and behold, she was less forgetful. She had an improved mood, a much more stable mood. She was not having as much agitation. And her one big goal was to be able to go to another state to a wedding weekend, which she was able to do. And she had a blast. So in summary, because we are living longer, and there's so much evidence supporting why certain people are more successful than others, we know that once you're over the age of 65, many habits are not sustainable and newer healthy ones need to be developed for the longer haul. The good news is we have control over so many factors that affect our physical and cognitive health. We can't change our genetics, but we can change our habits in order to live better. The most important thing is to know when the right time is to change the routine, the lifestyle, or even the living environment for yourself or your loved one. And I want to just say to everyone out there, you're not alone. Connect with others, reach out, support each other, and reach out to us at Gear Lodge. I will now take some questions. Got one here. What is sundowning? All right, sundowning is when you have dementia, it's a process of becoming overwhelmed with anxiety and maybe having some agitation. During the time that people are sundowning, they may not participate in their routine. A lot of times they will stop what they're doing, or they will be unwilling to go to the bathroom or eat. They may not know where they are. They may not know what time of day it is, and they may even forget who they're with. So it can be very frustrating. People who sundown in the beginning have awareness of it. And I went through this with my mother-in-law. It's very hard to watch in the beginning. Anybody else have any other questions? All right. Well, thank you all for attending, and please reach out to me if you have other questions about things we discussed today, and thank you.
Thank you. Excellent.